Now we are going to start the sensory system. The first topic is the somatosensory receptors. Okay, the receptors which are present mainly on our body surface, which conduct the somatic sensation. Okay, now there is a classification system for this somatosensory receptor. Number 1, mechanoreceptor. Mechanoreceptor means this receptor will be stimulated by mechanical deformation or changes in shape of the receptor will activate them. Mechanoreceptor. Now the mechanoreceptor can be of different type. Number 1, it can be a tactile receptor. Tactile receptor, we know tactile receptor means these are the receptor for touch and pressure. Okay, right. Second, it can be of nociceptor, right. Number 3, it can be proprioceptors. Okay, proprioceptor means all of you know that it is the receptor which gives idea about the position sense of joints in 3-dimensional space. Okay, so proprioceptor, what are the proprioceptors? Number 1, muscle spindle, most important proprioceptor. Second, Golgi tendon organ, and third is the joint capsule receptor. Okay, joint capsule receptor. We have to discuss detail about this muscle spindle and Golgi tendon organ, so don't worry. And number 4 is the polymodal receptor. They can also be activated by mechanical stimulus. Now one type of mechanoreceptor represents the special sense, that is the hair cell of organ of Corti. They are also mechanoreceptors. So these are 4-5 types of mechanoreceptor. Now second group of receptor is the thermoreceptors, right. Thermoreceptor, obviously you can understand that they are activated by temperature. There are 2 types. One is cold receptor for cold, and one is receptor for hot or warm temperature, right. Now this cold receptor, you have to remember this information, that they are active with a temperature range of 10 degrees centigrade to 40 degrees centigrade. Okay, and this warm receptor, they are active with a temperature of 30 degrees centigrade to 49 degrees centigrade. So there is an overlap zone. Okay, there is an overlap zone. Okay, in that zone both the receptor can act. Okay, but this cold receptor is maximally active at a temperature of 24 degrees centigrade, and this warm receptor is maximally active at temperature of 45 degrees centigrade. Am I clear? So you may ask that if the temperature is less than 10 degrees centigrade, then what will happen? Or if the temperature is greater than 49 or 50 degrees centigrade, then what will happen? In these cases, rather than thermoreceptor, nociceptor will be activated. Nociceptor activation will be there. Think that if I touch a 100 degrees centigrade temperature over your skin, what will you say? That this is very hot, or you will feel pain? Obviously you will feel pain, because temperature greater than 50 degrees centigrade generally activate more nociceptor than thermoreceptor. Similarly, if there is temperature of minus 30 degrees centigrade, we feel freezing pain, and that's why basically this is nothing but nociceptor activation, right. Now this thermoreceptor is maximally present. Maximum thermoreceptor is present at the level of lips, okay, greater than tip of finger. greater than fingertips. Okay, so maximally they are present at the level of lips. Okay, and in our body, cold receptor or cold spot are 3 to 10 times more than warm receptor or hot receptor. So please remember this few information about the thermoreceptor, right? Now coming to the third type of broad group, that is the photoreceptor. Photoreceptor is also known as electromagnetic receptor. Electromagnetic receptor, right? So obviously the examples are rods and cones, right? Number 4, chemoreceptor. Chemoreceptor. Chemical sense. Okay, what are the chemical sense? The smell and taste. They are the activated by chemoreceptor. They are the chemical senses. And apart from all that, already I have told one name, that is the polymodal kind of receptor. I have put this into the mechanical also. So polymodal means these are the receptors which are activated by multiple modalities of stimulus. Okay, right? For example, if I give pressure stimulus to the rods and cone, will they be activated? Answer is no. They cannot detect the pressure. They are only activated by light. But this polymodal kind of receptor, they can be activated by mechanical, thermal, chemical, different types of stimulant. That's why they are known as polymodal receptor. The examples of polymodal receptor are nothing but nociceptor. So nociceptor basically a polymodal receptor. Now after this classification, what is our job? Our job is to read detail about this tactile receptor, detail about this nociceptor, and detail about this proprioceptor. These 3 receptors we have to read in detail. Maximum question in sensory physiology from this only, right? So we are starting from the tactile receptor first. Okay. Tactile receptors. Maximum tactile receptor is present at the level of fingertips than lips. Okay, please remember, tip of the finger contain maximum amount of touch receptor, and also the lips. For obvious reason, you can understand what is the reason why you require more number of receptor on the fingertip and lips. Okay, now this tactile receptor are classified depending on their adaptation property. So I am writing first. One is rapidly adapting touch receptor, pressure receptor, and obviously rapidly adapting means other one will be slow adapting tactile receptor. Okay, now what is the meaning of adaptation? That I am coming a little later, but before that we have to know the names of these different rapidly and slow adapting receptor. So rapidly adapting receptor, most rapidly adapting receptor is Pacinian corpuscles, right? Second rapidly adapting receptor is Misner's corpuscles. Okay, and third is the non-specialized rapidly adapting receptor, that is the hair end organ, right? Okay, now on the other hand, slow adapting receptor, what are the examples? Slow adapting receptor are number 1 Merkel's disc, number 2 Ruffini's end, and number 3 free nerve ending. Okay, free nerve ending. Now we have to understand what is the exact functions of each of these receptors. Means they are dedicated for touch and pressure, but which type of touch, which type of pressure, we have to remember that. Now Pacinian corpuscle, number 1 point, it is the largest touch receptor in our body. Okay, so largest touch receptor. Second point, this is the most sensitive touch receptor in our body, most sensitive touch receptor. So anytime this can be asked in MCQ. Okay, and number 3, the best stimulus for activation of this receptor is vibration. Which type of vibration? High frequency vibration. Okay, the best frequency is around 200 Hertz. I am writing here. So see, this best stimulus for every receptor, we have to understand the best stimulus for every receptor. At least I have to remember that. Okay, so Pacinian corpuscle, vibration. What is vibration? Vibration is nothing but multiple touch to your skin. So this is a kind of touch receptor only, but which touch receptor is dedicated for detection of vibration? Pacinian corpuscle, particularly Pacinian corpuscle. Okay, if it is mentioned high frequency, obviously Pacinian corpuscle. If it is low frequency, other receptor are also there. I am coming there. Now number 2, Misner's corpuscles. Misner's corpuscle, what are the special point I should remember here? Number 1, this is the most numerous touch receptor in our body. Most numerous means maximum number of touch receptors which are present in our body is the Misner's corpuscles. Now what is the best stimulus for this Misner's corpuscle? Answer is movement. What is that? Means if you move your finger over your skin, you can easily understand even if your eyes are closed. How? By activation of these Misner's corpuscles. Okay, so this is movement over skin, right? And it can also detect vibration, but the vibration frequency for Misner's corpuscle is around 50 Hertz. Means low frequency vibration can also be detected by Misner's corpuscle. And hair end organ, I told you already that this is non-specific type of tactile receptor or touch receptor. Okay, so this is all about the rapidly adapting receptor. Now come to the slow adapting touch receptor, Merkel's disc. First point and most important, this is the only tactile receptor which is located at the level of epidermis. So please note down, this is the only touch receptor located at the level of epidermis. That means I am saying all other touch receptor that I have written here, they are located at the level of dermis of the skin. Okay, so epidermis level. Now if this is the Merkel disc, suppose this is located at the level of epidermis, Merkel's disc, the epidermis is little elevated at the level where this Merkel's disc is present. Elevated. This elevation is dome-shaped elevation, which was first time discovered by scientists, which is nothing but ego. He is a scientist who discovered this dome-shaped elevation. That's why Merkel's disc is also known as ego dome receptor. Ego dome receptor. Ego is a scientist. Dome-shaped elevation of epidermis, ego dome receptor. Now Merkel's disc, what is the best stimulus? Best stimulus for Merkel disc is point, sharp point. If I touch the tip of this finger here, so I can perceive that that's a single point. This determination of point touch is detected by Merkel's best. Okay, point, edges, okay, corner, edges of some table, edges of some bed. Okay, you can easily palpate that edges. That edge is best detected by corners, is best detected by these Merkels. Okay, so please remember point, edges, corner. It can also detect vibration. It can also detect vibration, but frequency should be very less, 5 Hz only, right? Then coming to the Ruffini's end. Ruffini's end, this is the receptor which is best stimulus for this receptor is stretch on skin. This is the best stimulus for the receptor, and Ruffini's ending is dedicated for detection of shape and size of handheld object. Okay, if I give a large object over your hand, it will produce stretch of the skin and you can easily feel and understand what is the kind of object. This is best done by Ruffini's end. This free nerve ending, it's detect itching and tickling sensation. Itching and tickling sensation is best detected by the free nerve ending, right? So now you have understood that these 3 slow adapting receptor and these 3 rapidly adapting receptor, what stimulus is best for them. Now among all these receptor, please remember Merkel's Misner's corpuscle is mainly present on non-hairy skin. Non-hairy skin is also known as glabrous skin. So this glabrous skin, the receptor which is exclusively present on non-hairy skin or glabrous skin is Misner's corpuscles, although Merkel's is also present mainly on Merkel's is also present on glabrous skin. Okay, now so obviously other all receptor is present on both hairy and non-hairy skin. What are the receptor left? We are left with Pacinian. So obviously Pacinian, then hair end organ, then Ruffini's, okay, then free nerve ending. All of them are present both on hairy and non-hairy skin. Okay, so especially I have to remember that non-hairy skin, one receptor if I have to mark exclusively, that is the Misner's corpuscles. Okay, now there is one particular controversial question, that is the 2-point discrimination. 2-point discrimination means if I touch 2 point over your skin here at the tip of the finger, will you be able to differentiate them or not? That is the 2-point discrimination. What is the principle? Principle is that to detect 2 point as separate, the receptor field of the receptor should be very small. Okay, receptor field means if this is a receptor, it can detect the sensation surrounding from a surrounding region, that is known as the receptor field. If the receptor field is very small, then you can detect 2 separate point as separately. So 2-point discrimination is best detected by Merkel's disc. Why? The receptive field is only 11 mm square. That is the smallest receptor field among any tactile receptor in our body. Although 2-point discrimination can done by Misner's corpuscle also. Okay, it has a receptor field of 25 mm square, but always you can understand the best picture will be given by the Merkel's disc. For the same reason, there is an MCQ that Braille reading Braille, all of you know that it contains some elevated small point or dot, okay, and these dots are separated by 2 to 3 millimeter. Okay, so what the blind patient has to do, the blind patient has to count how many dots are there and whether the dots are horizontally placed or vertically placed. They have to understand that. So suppose these are the dots in Braille, so I have to understand whether these dots are horizontally or vertically placed. But first of all, I have to identify the dot point. So what is the base stimulus? Again, the principle of 2-point discrimination. So the answer of this question is Merkel's, okay, rather than Misner's. Misner's is also responsible for Braille reading, but the best picture will be given by Merkel's. So this is about the touch receptor or tactile receptor. Now I told you the largest tactile receptor is Pacinian corpuscles. Now with the help of Pacinian corpuscle, we will understand how the receptor is activated and how that receptor activation leads to action potential generation, right? Okay, so suppose this is the cross section of the spinal cord. We all know that sensory afferent neuron enter through the dorsal region of the spinal cord, and the cell body of all sensory neuron form the dorsal root ganglia. So this is our dorsal root ganglia, right? And this end of this sensory neuron is present at the level of skin. This is present at the level of skin. Suppose this end contain Pacinian corpuscle. So this is the diagram of Pacinian corpuscle. So this is multiple concentric ring like layers are there on this receptor. So suppose this is Pacinian corpuscle. Now I am magnifying this Pacinian corpuscle here. I am magnifying this view. Okay. So how it will looks like. So inside the neuron. So this is the neuron, right? And this is my Pacinian corpuscles, right? Pacinian corpuscle. Now obviously Pacinian corpuscle is responsible for touch and pressure. They are myelinated neuron mainly. So suppose this is the myelination I am drawing. This is the myelination. Note down the first node of Ranvier is always located inside the receptor or within the receptor. Okay, so within this receptor, first node of Ranvier is there. Now whenever you give one stimulus over the skin, okay, look at, suppose I am giving this touch sensation over the skin. What will happen? There will be indentation of the skin. Okay, maybe small, maybe large, but whenever you give some touch sensation, it causes indentation of the skin, and that indentation will also causes indentation over the Pacinian corpuscle. So whenever you give some touch sensation here or touch stimulus here, what will happen? There will be a little depression on this Pacinian corpuscle. This depression means, just imagine that Pacinian corpuscle like a water filled balloon. If you compress the balloon from one side, what will happen? There will be increased tension. So this touch will causes increased tension inside this receptor. This tension will causes opening of some stretch sensitive ion channels which are present at the neuronal tip. So this ion channel will open up, and through this different cations will enter, mainly the calcium ion. Am I clear? So first, whenever you are giving touch, the receptor is depressed. Because of that, there is increased tension. That tension is opening stress sensitive cation channels, that is causing entry of cations in the form of calcium. Okay, mainly non-specific cation. Now this calcium will causes depolarization. So basically neuronal depolarization is going on. So this depolarization is nothing but this is a kind of local depolarization. Again, this local potential, local depolarization means this local depolarization cannot transmit it up to the level of spinal cord, obviously. But if this local depolarization is sufficient to cross the threshold voltage of this neuron, again the same formula, threshold voltage, it is crossing threshold voltage, what will happen? Huge amount of voltage gated sodium will open up at the node of Ranvier. Recall that node of Ranvier contain huge amount of voltage gated sodium channel. So all these sodium channel which are present at the level of first node of Ranvier will open up, and because of that membrane potential will rise up to plus 30 millivolt, and this is nothing but action potential generation. Whenever the action potential is generated, now it will easily transported from one node to the other node, and it will reach up to the level of spinal cord region. Am I clear? So this is the mechanism of action potential generation in the sensory neuron. Now what I told initially there will be entry of calcium. That calcium is producing local depolarization. If this local depolarization is above threshold, then action potential will be generated where the nodes of Ranvier, first node of Ranvier will be generated. So this local depolarization is occurring within the receptor only, it is occurring inside the receptor. That's why the local depolarization in these cases is known as receptor potential, or this is also known as generator potential. This was already asked in NEET exam. Okay, so please remember, receptor potential is nothing but it's a kind of local potential, graded potential, non-propagated potential. It does not follow all or null law, but whenever it produces action potential, that's a propagated one. Okay, so this receptor potential or generator potential. Am I clear? So this is the receptor potential generation mechanism. Now if I maintain the touch for long duration, what will happen? If I maintain the touch for long duration, simple example, if I hold your hand, or forget about me, suppose your boyfriend or your girlfriend is holding your hand and he is holding for the last 1 hour, do you feel the same amount of touch even after 1 hour? Answer is simple no. Okay, simple no. Why? So although your touch stimulus is still there, okay, but you are not feeling the same amount of touch. So what is happening? The thing which is happening here is known as adaptation to touch. Adaptation. So what is adaptation? So see, if you maintain the touch for long duration, what will happen? The receptor will adjust itself like this. Okay, so you are increasing the tension here. Okay, now to adjust this tension, receptor is expanding to other side. Just imagine it's like a water filled balloon. So what will happen? Whenever there is expansion of the receptor on other side, this tension will decreases. Now if the tension decreases, so tension is not there. If the tension is not there, then the stress sensitive ion channel will also not open up. If it is not opening up, what you think? This action potential will also not generated, and there may be action potential generation, but the frequency of action potential will be low. So basically, if the action potential is not generated, or if the frequency of action potential is low, then what will happen? Brain will perceive less sensation, because this transmission of action potential to the spinal cord will be low, and the brain will perceive less sensation. So how will you define this phenomena? So this adaptation means sustain presence of supra threshold stimulus leads to decrease action potential frequency. Now note down, sustained presence, that you understand, long duration the stimulus is present, it should be suprathreshold, mean initially the stimulus was such that it was crossing the threshold, and that's why action potential was there. So it's a suprathreshold. Although suprathreshold stimulus is present, but gradually your action potential frequency is decreasing. Why decreasing? Because of the phenomena of adaptation. Now look at the word frequency of action potential. What do you mean by this? Okay, so if I give light touch and if I give crude touch, how the brain will differentiate? Have you think ever? If I give light touch and if I give crude touch, how the brain will differentiate? Brain does not know. Brain only and only understand action potential. Brain only and only understand action potential. So if I give fine touch or light touch, okay, or if I give crude touch, what will happen to this action potential? Do you think the amplitude will increase? Answer is never, 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 because action potential follow all or none law. So what will happen? If I give fine touch and if I give crude touch will increases the frequency of action potential. Am I clear? So to explain this, just like see this. Okay, suppose I am giving a stimulus here. Initially what will happen? The receptor potential will be generated. Receptor potential is generating. If you stop stimulating in between, the receptor potential will vanishes in the same time. Okay, that is local potential. But whenever this receptor potential is adequate to cross the threshold, suppose this is your threshold, it will produce an action potential here. Now after this action potential generation, if I increase the strength of stimulus, suppose I am increasing the strength of stimulus, what will happen? This action potential will appear again and again, again and again, again and again, but the amplitude will remain the same. So basically, strength of stimulus is coded by increasing the frequency of action potential. This was the MCQ. Strength of stimulus on your body. Strength of stimulus on your body is coded by how the neuron understand, how the neuron code the strength of stimulus, coded by increase frequency of action potential, never, never, never amplitude of action potential. It will never increase. So if I maintain a suprathreshold stimulus for long duration, what is going to happen? This frequency of action potential decreases, right? So now I am giving you one task. Okay, suppose this is the stimulus. Okay, you will understand what I mean to say. Okay, so suppose this is the stimulus. This horizontal line means no stimulus. Now you are increasing the strength of stimulus. What do you mean by that? Suppose I am giving touch. Now I am giving more and more and more touch. Means what is happening? The skin is depressed more and more and more. Suppose 1 millimeter depression, 2 millimeter depression, 3 millimeter depression, like this. So I am increasing the stimulus strength, and then I am holding the same stimulus for long duration. Again I am decreasing the strength of stimulus. Simultaneously I am also recording the action potential. So this is the action potential recording from neuron. Okay, so whenever you have started the stimulation from here, action potential start appearing. So this single line means their action potential. So action potential coming. Now when you are holding the stimulus for long duration, action potential frequency decreases. Now again when you are changing the strength of stimulus, the action potential frequency again rises. Okay, this is one diagram. Your task, think which kind of receptor this is. And second, so this is stimulus. Okay, so increase strength of stimulus, and then I am holding the stimulus. Action potential recording. So action potential. Whenever you started the stimulus, action potential is appearing, and when you are holding the stimulus, same amount of stimulus for long duration, nothing is happening to the action potential. It is appearing in the same frequency as earlier. Okay, so now tell me what is happening in the first cases. Why this frequency of stimulus decreasing? What is the phenomena? Yes, this is because of adaptation of the receptor. Okay, so this is a kind of rapidly adapting receptor or slow adapting receptor. Yes, you are correct. This is nothing but rapidly adapting receptor. What are the rapidly adapting receptor in our body? Pacinian corpuscle, Misner's corpuscle, they will follow this kind of diagram. So rapidly adapting receptor, if you maintain the stimulus for long duration, this will quickly adapt and your action potential frequency will decreases. But whenever you are changing the strength of stimulus, it will be activated. That's why they are also known as phasic receptor. Means they detect the change of phase of the receptor. Okay, but they cannot maintain the tonic discharge. Okay, they adapt quickly. Phasic receptor. Okay, so rapidly adaptive receptor, because of the same property, they are best for detection of vibration cells. On the other hand, here this is nothing but slow adapting receptor. How do you understand? Maybe if you hold the stimulus for long duration, it will adapt, but in this diagram there is no adaptation at all. Okay, so obviously they are the slow adapting or late adapting receptor. So this late adapting receptor, they are discharging continuously whenever you are holding the strength of stimulus. That's why they are known as tonic receptor. Tonic receptor. They are best for detecting steady stimulus. They are best for detecting steady stimulus. And based on this adaptation, we have already divided the receptor into rapidly adapting and slow adapting receptor. Am I clear? So this is all about the tactile receptor.